So the endocrine system and the nervous system work together to control the metabolic activity of the body, in simple words. So all the metabolic activities which happen in the body are basically regulated by these two systems in our body. Now, endocrine glands are ductless, and this means that that the hormones produced are put into the bloodstream to be taken to other parts of the body. In simple words, blood is the carrier, and whether it is insulin, whether it is thyroid, whether it is thyroxine, whether it is any other hormone, basically it is the bloodstream which is the carrier for all the hormones in the body, as we all know. Now, the hormones of the endocrine system, they produce specific effects on body functions very slowly, and this is due to the slow release of the hormones. So it's not just that if insulin is produced, it will be produced at one stretch, at one go. Thyroxine is not produced in one go. So all the hormones will be produced in a very slow release pattern. By contrast, the nervous system brings about very fast changes, and this is because the nervous system does not use chemical messengers; it uses electricity. So in simple words, it uses the neurochemical system. So where the neuroelectric system, where basically the changes or the signals are much more faster naturally, and then the slow release of the hormones by the endocrine system. Now, if we talk about combining the two systems, it's like this. So adeno gland and makes adenomas. Adrenal gland makes in the adrenal gland makes is related to adrenal glands, and the surgery done for that is adrenalectomy. So adrenal comes from adrenal gland, which causes adenoma, and in the treatment is adrenalectomy. Similarly, it's calcium, which which causes calcemia, hypercalcemia, hypocalcemia, and the glucose is basically glucose, which causes glucogenesis or gluconeogenesis, and the hyperglycemia. So the conditions are connected to are basically related to the terms which are basically the chemicals. Now, from pancreas, it's pancreatitis, and from thymus, it's thymoma. From thyroid, it is thyroiditis or hypothyroidism, which basically that surgery is thyroidectomy. All the major hormones circulate within the bloodstream. Each one has a specific target organ. So it's a target organ system. So again, dysfunction of the gland may result in hyposecretion or hypersecretion of the hormone. For example, it's hypoinsulinemia, which will cause high blood glucose, hyperinsulinemia, which may happen in insulinomas, which will cause acute hypoglycemias or recurrent hypoglycemias. Similarly, thyroid hormone, thyroxine, hyperthyroidism, more secretion of thyroid hormone will cause hyperthyroidism. Less secretion of thyroid hormone will cause hypothyroidism, right? So what are the characteristics of these hormones? So again, they are basically chemical substances produced by specialized cells. They are slowly released in minute amounts directly into the bloodstream, and they are produced by endocrine glands, and they are inactivated or excreted by kidney or liver. Now, if we talk about specific glands, so again, we'll talk about pituitary. So pituitary is located in the brain. It has two parts, again, an anterior, which is antero, and posterior, which is also called as posterior. The anterior and posterior parts are called lobes, so also known as hypophysis, which is basically the anterior lobe. So the problem which happens with pituitary is the hypophysis, where anterior lobe effects is adenohypophysis, posterior lobe effect, it is the neurohypophysis. So as I was mentioning, the adenohypophysis produces 5 hormones, which is growth hormone, thyroid stimulating hormone, adenocortical hormones, that is ACTH, FSH, luteinizing hormone, that is LH. Then the neurohypophysis has 2 hormones, that is ADH, antidiuretic hormone, and oxytocin. The overproduction of growth hormone produces a condition called as gigantism. Underproduction of growth hormone causes a condition like as dwarfism, right? Again, recall that a combining form of extremity is the ACR and O. So again, therefore, the word denoting enlargement of extremities is basically acromegaly. So ACR comes from acromegaly. So this condition is a result of a hypersecretion of growth hormone after puberty. This disorder is characterized by enlarged bones of hands, feet, and head.